Fact number 26. What drugs can cause dilated cardiomyopathy? Trastuzumab and doxorubicin. It's very important to note that trastuzumab causes a reversible cardiomyopathy. I remember this by using the alphabet. So T in trastuzumab and R in reversible are closer together. Doxorubicin, on the other hand, is irreversible. And you can also use the alphabet technique I just spoke about to remember. Another extremely high yield fact is that dilated cardiomyopathy can be prevented or treated using dexrazoxane. This is a cardioprotective drug that's used to prevent the side effects of these chemotherapy drugs. Another high yield point is that alcohol also causes dilated cardiomyopathy. And these two chemotherapy drugs, trastuzumab and doxorubicin, can both be used to treat breast cancer. Administration of sodium nitroprusside can cause the accumulation of what element? Cyanide. It's very important to watch out for this when managing patients with hypertensive emergency. Another common cause of cyanide poisoning is a house fire. These patients usually present with lactic acidosis, altered mental status, and cherry red skin changes or even cherry red blood. What drugs can be used to treat non-pregnant patients with Rocky Mountain spotted fever? Doxycycline. Rocky Mountain spotted fever causes a rash on the palms and soles. Diseases that can cause this clinical presentation are extremely high yield for the USMLE. If you want to learn more, check out this video right here for high yield pediatrics and family medicine points. So, if you know what drug is used to treat Rocky Mountain spotted fever in pregnant women, leave the answer in the comments below. How do you treat Entamoeba histolytica infection? Metronidazole. What drug can be used in a woman who is currently pregnant and has a previous history of preeclampsia? Aspirin. Hypertensive disorders in pregnancy are extremely high yield, so they can be tested in so many different ways, especially with pharmacology. So I'll be releasing a video talking about this soon. Let's move on to fact number 31. Which drugs are best for a patient with a previous or current history of gastric ulcers? COX-2 inhibitors. How do you manage someone with heparin-induced thrombocytopenia? Stop heparin and administer a direct thrombin inhibitor such as agatroban. Is furosemide safe to use in a patient with a sulfur allergy? Definitely not. An alternative to furosemide in patients with sulfur allergies is ethacrynic acid. Which drugs can cause gynecomastia? We can remember these drugs using the mnemonic DISCO: digoxin, isoniazid, spironolactone, cimetidine, ketoconazole, and estrogen. The most commonly tested drugs are ketoconazole, an antifungal, and spironolactone, an anti-androgen medication. If patients are taking spironolactone and they develop gynecomastia, then the alternative would be to switch them to eplerenone. Drugs that can cause gynecomastia aren't limited to the DISCO mnemonic. Another mnemonic you can use is some drugs create awesome knockers. And this means spironolactone, digoxin, cimetidine, alcohol, and ketoconazole. Which antihypertensive should patients be switched to if they experience cough from a previous antihypertensive? ARBs. It's very important to note that ACE inhibitors can cause cough and angioedema due to bradykinin buildup. So these patients should be switched to ARBs. What drugs can cause drug-induced lupus? We can remember most of these drugs using the mnemonic SHIP: sulfonamides, hydralazine, isoniazid, phenytoin, and procainamide. Other important drugs include quinidine and methyl-dopa. If you have a mnemonic to include these into the SHIP mnemonic or create a new one for all of these drugs, please leave them in the comment section below. What drugs can cause agranulocytosis? Antithyroid drugs, clozapine, carbamazepine, and chloramphenicol. I use this by thinking about AC. And to remember this, I added the visuals of 3 ACs here. So it's also important to note that chloramphenicol can also cause gray baby syndrome. You can suspect that a patient has agranulocytosis by the lab values, of course, but also if these patients are taking any of these drugs and then they develop this awful fever. What is the most likely drug that would cause a red rash on the neck after being treated for an infection? Vancomycin. So this antibiotic can be used to treat infections such as MRSA. The condition that the question stem is describing is called red man syndrome. Which anti-diabetic drug should be held before doing a CT with contrast? Metformin. Which lipid-lowering drug can cause flushing? Niacin. So this is a very high yield side effect of niacin use. Basically, niacin causes peripheral vasodilation and then the release of histamine and prostaglandins. And this can result in flushing and generalized intense itching. What drug inhibits reabsorption of cholesterol in the GI tract? Ezetimibe. Which antidiabetic drugs can cause weight loss? GLP-1 agonists and DPP-4 inhibitors. Which antidiabetic drug has an increased risk of hypoglycemia? Sulfonylureas. Which drug can be used in the management of chronic myeloid leukemia? Imatinib. Imatinib is a tyrosine kinase inhibitor. And recall the translocation in CML. That is a 922 translocation. So if you want a quick review of these translocations, be sure to check out this video right here. What 50S inhibitor can cause serotonin syndrome? Linezolid. So there are antibiotics that can cause neuroleptic malignant syndrome and serotonin syndrome. Check out my video comparing serotonin syndrome and neuroleptic malignant syndrome to learn mnemonics to remember these high-yield pharmacology facts. What is the mechanism of action of vincristine? It inhibits the polymerization of microtubules. It's also important to note that vincristine can cause peripheral neuropathy. What drugs can cause pulmonary fibrosis? Busulfan, bleomycin, amiodarone, and methotrexate. So if a patient is started on any of these drugs, and then the question asks, what is the next best step? The answer would be a pulmonary function test. This is important to figure out lung function before starting therapy, since they have the potential to cause pulmonary fibrosis. Also, recall that bleomycin is effective in the G2 phase of the cell cycle. And the mechanism of action of methotrexate is to inhibit dihydrofolate reductase. Methotrexate is used in autoimmune diseases such as rheumatoid arthritis, choriocarcinoma, or ectopic pregnancies. So if a patient is noted to have profound bone marrow suppression, the rescue agent you can use in these patients taking methotrexate is leucovorin. What antidiabetic drugs increase the risk of UTIs? SLG2 inhibitors. And if you look at these drugs on the screen, you can see that most of these drugs, if not all, have flow in it. So how I remember that these drugs cause UTI is like the flow of urine, and then the UTI would be caused by the flows. Which drugs can cause photosensitivity? Sulfonamides, amiodarone, and tetracyclines. How I remember these drugs is that you sat for a photo. So sat for a photo. What drug can be used to prevent vasospasms after a subarachnoid hemorrhage? Nimodipine. This is a calcium channel blocker, and there are many high-yield facts for subarachnoid hemorrhage. But it's crucial to note that the next best step in a patient with subarachnoid hemorrhage is a non-contrast head CT scan. If you have a very high clinical suspicion of subarachnoid hemorrhage, but it's negative, then you do a lumbar puncture to look for xanthochromia. Remember that if a patient has adult polycystic kidney disease, this also increases the risk of subarachnoid hemorrhages. Also, on your exam, if you see mention of prevention of an ischemic stroke after a subarachnoid hemorrhage, the answer is also nimodipine. So I hope this video was helpful. If you enjoyed it, be sure to power up the like button, hit subscribe, and that notification bell. As always, thank you so much for watching, and to continue learning more, click this video right here.